Does protein affect your risk for cardiovascular disease? When we think of cardiovascular disease risk, we've been told to pay attention to how much fat we eat. If you have followed the more up-to-date research, you have discovered that it's not really how much fat you eat, but rather what kind of fat you eat that is important. The type of fat we find in nuts reduces our risk, and saturated animal fat increases the risk. That's what we find if we scrutinize the research more closely, even if some people will tell you otherwise. So, what about the protein we eat? Can that affect our cardiovascular risk? Yes, it can. When 43,960 men between the age of 40 and 75 years were followed for 18 years, they found that higher intake of animal protein was associated with an increased risk of ischemic heart disease. The research is provided as a free article. If you follow the link we have provided, you can access the whole article and read some interesting facts at the end under discussion. This also holds true for women. When 29,017 women followed for 15 years, substituted carbohydrates and animal protein for vegetable protein, cardiovascular mortality decreased by 30%. What are good sources of vegetable protein? Beans and nuts. They are not only good sources of vegetable protein, but also a good source of high nutrient, low glycemic index carbohydrates and healthy fat. That seems to be the reason why these women reduced their cardiovascular risk when carbohydrates were substituted for vegetable protein. They decreased their intake of grains and ate more beans and nuts.